welcome to This is Public Health. I'm Jennifer Demuth with the Tuscarawas County Health Department, and today we're going to talk about a subject that is related to school, and sometimes that's not a great topic for little ones, but for those of us who are adults and have children in our lives, such as nieces, nephews, obviously children, grandchildren, this is important and something to think about as we think about our children being in school. And so what we want to talk about today is Vaccination 101. Why are vaccinations important and what do they do to protect our children? And we're going to have a couple of experts talking with us today. We're so thankful to have them here with us. First, we have Valerie Wallace. She's an RN and a public health nurse at the Tuscarawas County Health Department. Welcome, Valerie.
Thank you.
Good to have you.
Good to be here.
All right. And we're also very thankful to have with us the Director of Nursing for the Tuscarawas County Health Department and also an RN, Amy Kaiser. Amy, welcome.
Welcome back at you. Thank you.
So glad to have you here today. So, if our theme today is, Vaccination 101 and we've got a kind of school theme, that makes you the professors today.
Okay.
Is that good?
Yep,
All right.
I think so. Session.
All right. So I think we're in good shape. So let's start by getting, just a general understanding of vaccines. And one thing that comes to mind, during the pandemic when things were closed down, we saw a lot of people for various reasons not being able to get to their healthcare provider to get vaccines and really other kinds of care as well. And so there are a lot of families out there that might need to have their children get caught up with recommended vaccinations. So, tell me a little bit about vaccinations in general. What is the goal ultimately of getting a vaccine?
That's a good question. So, there are vaccine preventable diseases, and that's what these vaccines are for.
Okay.
And, because years ago we had a lot of cases of polio, of whooping cough, of hepatitis, which is an infection of the liver, some of those diseases. And, it affects children's heart. It affects their lungs. Some individuals with polio, as the old pictures with them walking with the braces and the crutches, things like that. So these vaccines have been proven to help protect against that. And the more individuals that we have vaccinated against these vaccine preventable diseases, the more we have what's called herd immunity, which we can protect those around us. And some of those around us, due to whatever medical reasons, may not be able to get the vaccine from hopefully not getting that particular preventable disease as well. So it's very important to keep individuals up to date. We have been seeing a decline overall, not just in the state of Ohio, but in the country these last couple of years, with folks getting their children, up to date, with their vaccines. And we have been seeing a couple of these eradicated type of preventable vaccines in our country again that we haven't seen in a while. I know measles has been one, polio, and there's been a couple of suspected cases of rubella. And I think the polio has been eradicated since like 1994. So we are starting to see some of these minor things cropping up. However, where we know there's one, there could be more. So, we really don't want to go backward.
Right. Yeah. Because if you think of history, and you read about times when there was a lot of tuberculosis,
yes.
There's a lot of old tuberculosis hospital facilities in Ohio. And it was really a serious thing, as polio was, know, and primarily the reason we don't have much of that anymore is because of vaccines, correct?
Correct.
Okay.
Correct.
Wow. All right. So it sounds like vaccines, are definitely important for us to consider and get the facts about and have those children protected when we can.
Exactly. I mean, you can find a lot of different things on the internet nowadays and pros and cons or whatever, but it's very important to have those conversations with your healthcare provider and to get the facts from respectable resource, such as the CDC or immunizations.org or some of those sites that, can give you the scientific data.
Would a pharmacist be also a good resource
Yes, absolutely.
of information?
Yeah,
okay,
yep.
Excellent. And so we know that vaccines are very important to protect us against disease, especially those diseases that thankfully vaccines have helped to mostly eliminate.
Correct.
But why are they such an important thing for children to have at at the recommended
ages? Yeah. So studies that they do for these vaccines are based on the child's age and trying to build that immunity. And when they do these studies, they find like at certain ages, this is a good time to start that because they build those antibodies, and then you get the next dose, to build it more. And they have found over time, these are the right age groups to help when they're forming and the child's growing to get those antibodies that they need at that time. So, and that's what's confusing too for some folks, is why now we have to get a third dose when we only had to get a second dose, and how come we've got to get it at this time and so many months after this one. And again, that's all based on research, and that's always evolving. I mean, viruses are always evolving. So, a lot of this is based on the research that they're doing and what they're seeing globally as well, with some of these diseases, and trying to figure out what's the best time frame to get that best immunity. What do you think, Val?
I agree. It's very important to get your child vaccinated on time. The last 2 years, the numbers for up-to-date kindergartners have dropped. And it's, probably due to the pandemic. People did not want to take their children out, and so they got behind. So it's real important to keep your child up to date. And, these easily preventable diseases could increase if parents aren't vigilant about getting their child vaccinated.
Right, because the goal of these doses is, I know it's difficult to kind of try to bring them back like in 2 months and again in 6 months and whatever, but the studies have shown that to get them considered fully up to date, you need to complete that entire series. So it's kind of like eating one piece of cake and you've got the rest of the cake sitting there. You're not going to get the whole cake consumed unless you eat it all. I know that's kind of a weird analogy, but the same thing's with the vaccine. If I'm just getting this one dose and I have 3 more to get, I'm not getting
the full
effect of it. I'm just getting some, yes. Could it be enough to protect them? Possibly. But for the best protection, the idea is to complete that series.
Complete that recommended course.
Correct.
Okay.
Yeah.
Very good.
Yeah.
I know like my grandparents have talked about when TB was a thing, when polio was a concern. For me, that was before I was born. But one thing I can think of is when I was a kid, just about everybody got chicken pox, and you would get chicken pox and you were out of school for a week and you were miserable and you were scratching and probably had a fever. And, with my kids, they didn't ever have to get chicken pox because there's a chicken pox vaccine, that they were able to get as children, so I just think that's how the science and the medical research, has
evolved.
Benefited. Yeah, there's so many things that used to be ailments and things that would, knock a kid out of school for a week, like chicken pox, that you don't see often anymore thanks to vaccines.
And I think that's why some parents might be hesitant to get a vaccine because they've not seen it in their lifetime. So they don't maybe recognize that this really was a big thing.
Absolutely.
And now that it's not around, that kind of out of sight, out of mind kind of thing.
Yeah. But these illnesses could still be
there.
threat.
And they're still in third world countries,
Sure.
Where the vaccination may not be up to date or even available. The vaccine might not even be available, if they're living very rural areas. But I think sometimes we forget that these diseases were very devastating at the time, and we don't see them today because of the vaccine. But for some, it's like, why should I vaccinate my child when it's not even around? Well, it's not around because
we're vaccinating.
Right. So it's kind of go ahead, Val.
And I think while we were talking about chickenpox, a lot of people, I think, they feel like, well, I had chickenpox when I was a kid and I was fine, so why should I get my child vaccinated? He should just get the disease and be fine. But I think it's important to note that as you get older, chickenpox or varicella is worse. So, with a vaccine, which is working great, sometimes people are older before they're ever actually exposed to chickenpox if they're not vaccinated. And it's worse as you get older. So there's been cases, not locally as far as I'm aware of, but where a parent has actually died from something like chickenpox that they got from their child because they weren't vaccinated, had never had it.
Wow.
So,
because as an older person, it affects them differently.
It affects them differently. And so,
didn't know that.
Something that like chickenpox isn't necessarily as easy to get through as what a lot of people think. It can still be devastating.
Yeah.
Same as whooping cough. you know, the DTaP with the pertussis in it, which is whooping cough, you know, you're protecting not only yourself, but others around you from getting the whooping cough, you know, and we've seen deaths from that too. Very severe coughing episodes where,
I mean, I've heard of some babies still being hospitalized with whooping cough.
Yeah. I mean, it's a very serious thing. That again, we don't see a lot of it, but when we do, sometimes it can be pretty serious.
Pretty devastating.
Yeah. And if we have a tool like the vaccine that can prevent this illness in our little ones and in ourselves as adults, you know, maybe it's a really good thing to consider, so that we can prevent that.
You know, we put helmets on our children when they're on their bikes or their scooters, and we put them in car seats or seat belts depending on their age. Hold their hand while we're crossing the street.
Right.
We do that to keep them safe. So vaccines is another way to do that. We're keeping our children safe and we're keeping them healthy.
Yeah, as safe as we can. I like that. So we've touched on the names of some of these vaccines. You know, we talked about chicken pox and mumps and rubella and then pertussis, also known as whooping cough. Could we list, you know, what those recommended vaccinations are for infants and children?
Well, I brought my list because I have to read it off
I know.
here.
It's a long list.
Yeah, it is. The Ohio Department of Health actually on their website will have the Ohio Immunization Summary for school attendance, and it does give like a really good
breakdown
definition of which one it is, when they're due, the time frames in between. This is what we give to school nurses as well, so that, and we have this in our clinic, so that we know what to do when. And there's also a catch-up schedule that we have, that if somebody is behind, there's a way to help them get caught up on their vaccines as well.
That's good to know, because there's probably some people who maybe are behind because they couldn't go during the pandemic to their provider.
Right. So basically, you know, kindergarten, there's quite a few kindergarten vaccines that are needed. Some of those, again, are the Tdap, which is your diphtheria, tetanus, and pertussis. And there's more.
I bet.
Yeah, there's a lot more. There are measles, mumps, and rubella, polio, chicken pox. So, you know, there's quite a few. I do know too that there's some worry for parents that they don't want too many vaccines given at once because they're afraid it's going to overload the system. Well, studies have been done that, I do have that here too, that the immune system can actually handle all 14 scheduled vaccines if they were administered at one time to the baby. So, you know, the baby can handle, the child can handle all of these vaccines. So it's not going to overload their system. It's not going to overload their immune system.
It's not going to make them really ill.
No. I mean, they still, and again, that's another thing, side effects versus adverse reactions. As far as side effects, yes, they may have a sore arm, they may have a little bit of a fever, they may feel a little cranky. You know, those are side effects from the vaccine. That's your body's way of making antibodies to give you that protection. So that's a kind of a known thing, kind of an expected thing. Versus the adverse reactions are more respiratory in nature and not being able to breathe right. You know, so again, I think just talking that through and asking those questions, you know, we would be more than happy to walk anybody through that to ease any concerns that they may have. But did you have something, Val?
Well, those minor side effects that you're mentioning, the sore arm, sore leg, maybe a little bit of fever, that's much better.
Yes.
You know, going through that than getting the actual disease itself.
Right.
Oh, absolutely.
Right.
And, you know, you were mentioning the side effects. And, you know, I remember when my kids were smaller and we were getting their recommended vaccinations, wherever I went to get the vaccination, they always gave us a little paper that explained what vaccinations the children received that day and explained to me what the regular side effects were. So if I got home and 24 hours later, you know, my baby back then had a little knot like in the muscle of his thigh, you know, I knew that was normal because the paper was right there. And that was really helpful, you know, as a parent, especially with my first child, you know, because you're always a little more anxious with the first one. And just to be able to look at that informational sheet and say, okay, this is normal, I don't need to panic, or, oh, he has a slight fever, nothing to panic about. It's nice that you guys provide that information.
Yeah, that's actually a requirement for those administering vaccines. It's called the vaccine information sheet.
Okay.
And we are required to hand those out with every vaccine that
So
we administered. So
everybody
to
will
have that
get
information.
all the facts about the vaccine,
Exactly.
and they'll know
Sure.
exactly
Yeah.
what
Yep.
to expect, which is
Yep.
so helpful. As parents, we don't always know what to expect, so this is one area where we know.
Right. And 7th grade, they're due again for their Tdap and for their meningitis vaccine.
Okay.
And then their senior year, they get that second meningitis vaccine. I will say, though, for that particular age group, the seniors, the meningitis shot has 4 different stereotypes in it, or whatever I think it's called stereotypes, in that vaccine. The AWYC, I think it is.
Yes. Mm-hmm.
But there's another one, the meningitis B, the meningococcal B vaccine. For whatever reason, they can't mix it with
The regular
vaccine
meningitis
that has the 4.
Okay.
But to be fully protected, it's really a good idea to get that meningitis B vaccine as part of that dose, because they're finding like 60% of individuals that get meningitis, it's the B
Okay.
that they contract.
So for our listeners out there, because this can be
it's
confusing.
confusing. It is
sure,
confusing.
And because I've been fortunate as a parent who works at the Tuscarawas County Health
Yeah.
Department that you have taught me this as well. I thought when my children got the meningitis vaccine at 7th grade and before 12th that they were protected, and learning that, oh my goodness, that doesn't protect against meningitis B
Right.
was a real eye opener for me. And I think it's one that a lot of parents and guardians aren't aware of. And
Right.
I wasn't, and I've worked in healthcare my whole professional life. So, so
Right.
again, making that real clear, that is not part of the not part of the required vaccination.
No.
It would be an extra one that parents or guardians would need to get.
Yeah, so to provide the fullest protection, especially for that that junior going into their senior year,
Okay.
is getting that additional
Meningitis B as well.
Yeah, just consider that part of getting the meningitis vaccine. Yeah, go ahead, Val.
And that'll protect them in college as well. When they go to college, they're in these cramped dorm rooms, they're in crowds, they're football games or wherever they're spending their time. So there's just a lot of close activities going on in college. And so, also getting protected against meningitis B will help with that.
I think even maybe if they're going to a trade school, because some trade schools have a
because they're
lot
still around there
of close contact.
and that close contact. And for those of you that don't know, meningitis is actually a swelling of the lining of the brain and spinal cord.
So it's pretty serious.
Well, yeah, and if you've seen the commercials on TV, I mean, kids get hearing loss, they lose extremities. There's some really severe side effects. And the thing with meningitis, once it attacks, it is what it is. I mean, there's not a lot of good treatment for it. Go ahead.
You can get very sick very quickly.
Yeah, and once you are symptomatic, it's almost too late.
Okay.
So very
get
important.
the required meningitis vaccines for your kids at 7th and 12th, and opt in for the meningitis B vaccine.
Absolutely, absolutely.
Really good to know. So we were talking a little bit about some misconceptions. We were talking about people, being worried about side effects, and that's understandable. So what, one thing I've heard a lot out there is, folks who believe that vaccination can cause autism. And, obviously that's a real concern.
Sure.
Can you address that?
So there has been quite a few studies done, and they now have identified symptoms of autism in children actually start appearing well before they receive that MMR vaccine, which is what they're thinking. A lot of folks think is linked to autism.
Okay.
And even more research provides evidence that autism develops before the baby is born. So there's a lot of studies out there showing that for some, the majority of babies, unfortunately, are showing signs even before they're receiving a vaccine. So there's really not a lot of identified research on
that says,
linking that.
Okay.
Correct.
So there's no
Correct.
research that's linking immunizations.
Not that I've been able to find, but what about you? What do you think?
Autism.
No research that's credible. I think several years ago there was a study that was done that did try to link autism to MMR. But later on, as more scientists looked into that study, it was found to be faulty.
Okay.
But that information was already out there. And so it's hard to pull that
People
back
are looking
in
at that
once
old
they've heard
information,
of that. Right,
and
but
not the newer
one that's been
data.
proven to be not accurate and a faulty study.
Okay. Are there any other, common misconceptions out there about vaccinations? I know, Valerie, you in particular have a strong background in working as a school nurse.
Sure, yeah.
So are there some other concerns that are common that you've heard from parents in the past that we may want to address and share?
I think parents are always concerned about safety, vaccine safety. These vaccines, they are researched and they are tested. They would not release a vaccine that was not safe. We've talked about side effects. They're very minor. There are some children that can't take certain vaccines because they may have an allergy to certain components.
Okay.
And that's where herd immunity comes in, as we've talked about, that it's real important for those children that can get vaccinated to be vaccinated properly and protect those children that may not be able to be completely vaccinated.
So Valerie, I'm going to interrupt for a minute.
Sure.
So if a parent or guardian, has a concern about a child's allergy and how that may impact the vaccine, is it just something they should really talk with their healthcare provider about?
Absolutely. Talk to your healthcare provider before vaccines are given if you're concerned. Do your research. But with the age of internet, there's a lot of things on the internet that isn't particularly accurate.
Right. So it's important to check the sources
absolutely.
of the resource.
CDC, ODH are great sites. Sites that involve actors and actresses probably are not.
Yeah.
Okay. Good advice. All right. Any other common questions or misconceptions that you've heard from parents over the years?
A lot of parents get confused as to what vaccines are due when, and that can be a problem. So I know we did talk about school vaccines, but I just wanted to point out, like for DTaP, there's 4 or more doses that are required for kindergarten. And I say 4 or more because that last dose has to be after the age of 4.
Okay.
Same thing with polio. It's 3 or more doses are due. Again, that last polio has to be after the age of 4. And 2 MMRs, which is measles, mumps, rubella, 2 varicella. There's 3 hepatitis B doses that are due. Now, that first hepatitis B dose is usually given as a newborn while they're still in the hospital after delivery. And it's real important to keep track of that dose, because when you go to enroll your child in kindergarten, they need to, the school nurse needs to see all 3 doses. Okay. So, and sometimes it's hard to track back 5 years and track down that dose. You'd have to get into talking with medical records at the hospital to be able to track down that first dose if you don't have a record of it. So it's real important to keep that paperwork.
That's really important. Yeah. Because if there are people out there who are about to become parents for the first time, or maybe have an infant right now and they're listening, just remembering that importance of keeping that record
your
for
records,
the vaccine,
right.
and keeping it in a safe place with your important papers so that you have
Absolutely.
it. Okay.
And we've even, as a school nurse, I would get calls from graduates, sometimes 15, 20 years later, needing their vaccine record because they decided to go back to school.
Wow.
And they needed proof of their immunizations. And schools don't always keep those records for 20 years. So it's real important, even as a graduate, that it'd be a good idea to give your high school graduate a copy of their vaccine record, but then keep one on the side so you make sure you have it too. So if they lose it,
Well, that's funny that you mentioned that, because even as an adult, I had a cut several years ago, a bad cut. Didn't require stitches, but it was pretty bad. And I remember the doctor saying, when was your last tetanus shot? Well, good question.
Get in my mental file cabinet and look at it.
So even as adults, to kind of keep that record always in an important place is not a bad idea, I think.
Sure. And schools, so a parent has 14 school days to get their child's immunizations up to date and turned in after school starts, or the school can exclude your child from school. So now that would include extracurricular activities. So, football, volleyball, the sports activities, the drama or band. Now, when I say that, a lot of vaccines are series. So you may not be completely up to date, but as long as you're in process.
Working toward it.
You have to have a certain amount of time between vaccines sometimes. And so as long as you're in process, because the schools they have to file their reports in mid-October. Some schools get audited, their files, that we have to do that. ODH decides which schools does that. So they're accountable for their reports as well, not just, saying that you have to turn it in.
And yes, accountability is important, but it's about the safety of all the children at
for
the
sure.
school. By doing the due diligence and, keeping up with those vaccinations, the schools are making sure they're keeping those students as safe as they can and hopefully preventing them from being exposed to, some nasty virus like polio or, something else.
And I think some parents feel like if I give them the vaccine, they're going to get the disease
I've
from
heard
the
that.
vaccine. And again, some of those just might be the side effect that they're feeling, but I think there is that fear if I give them this, they're going to get it from the vaccine.
Right.
And there have been very limited studies showing that happens.
Right.
It
really doesn't
It
happen.
really doesn't happen.
Yeah. Okay.
So
That is
I think that's another fear. Maybe.
really good to know. Yeah. So there's another vaccine that is recommended that is start in childhood, and that is the HPV vaccine. And that's another one that there are some misconceptions about. So if you'd like to share just a little bit about the HPV vaccine and what that is and why that's an important thing for parents, guardians to consider.
So the HPV vaccine, it's a vaccine, depending on what age you start, it may be 2 doses or 3 doses. And it is meant to protect against this virus that can cause cervical cancer.
Okay.
And it can cause other kinds of cancers too. And I think parents are concerned. They're worried that if they give their child the HPV vaccine, that is just the okay to go out and do things that they don't want their children doing. Intercourse, that kind of thing. Or some parents may think that boys don't need to have the HPV vaccine, but they absolutely do because they're protecting future partners. And there has been a rise in other cancers besides just cervical, so it's real important that they get that vaccine. It's not a requirement, but again, it's recommended.
Okay. And I know I've heard, again, working at the Tuscarawas County Health Department, I benefit from talking with you regularly. It's helped me be a better parent and protect my children better, I think. And I've heard someone, I don't know if it was Amy or Valerie, mention at one point that the HPV vaccine doesn't just protect against cervical cancer. New research is showing it's helping to protect against other cancers as well.
Throat cancer. Other kind of cancers other than just cervical cancer. And they have found through research that to get that protection before you're sexually active actually provides the best protection, because the majority of us have probably been exposed to HPV. For some, it does become cancerous. So they're finding that the best protection is to have those vaccines hopefully before you are sexually active.
And cancer is a very scary word.
It
is. If there's one vaccine, we can consider as parents and caregivers to get our children that may prevent cancer later in their lives, it's definitely something worth considering.
And they've done research too of increasing that age to folks, even adults. So, this is just a still ongoing thing with HPV, but it's, I've seen videos about HPV and testimonies from individuals that have had HPV who have passed away from HPV. It's a real thing, and it's something, parents don't want to think about because they don't want to think about their child being sexually active at some point. But again, you're providing that protection to hopefully prevent that child going through a cancer that maybe they didn't have to go through.
And you don't want to have to look at your child as they're an adult maybe suffering when you could have provided them something that would have stopped that, would have kept that from happening.
Yeah. So, ladies, I think we've done a really good job covering Vaccination 101 for children and teens. And so I'm guessing that a lot of our listeners might be thinking, but how do I get these vaccines? And I know, obviously, we want them to talk to their healthcare providers. And some healthcare providers do have the ability to give vaccines in their offices. But if their healthcare provider can't, what are some other ways that the Tuscarawas County Health Department can help others, get those vaccinations?
Sure. So we have an immunization schedule. They can call for an appointment. We do accept most insurances, and thankfully, most insurances cover the cost of the vaccine. There might be, of course, your deductible if you haven't met it. We do have an administration fee. So there might be some additional fees, but again, depending on your insurance, what the coverage is, we can do that. We also have a program through the Ohio Department of Health called Vaccine for Children. And it's a program for individuals who do not have insurance for children. It's for 18 and under. And for individuals that do not have insurance, or what are called underinsured, meaning maybe for whatever reason, their insurance doesn't cover the vaccine.
Or would it also cover if they have a really high deductible?
No.
No? Okay.
No. Because if the vaccine isn't covered, then they have some way of getting it. This vaccine is kind of like that safety net for those that fall into those categories of being on Medicaid, being underinsured,
or not having insurance
being not
at all.
insured at all. Certain ethnic groups. So there's some things that we can help with. Now, again, the vaccine is purchased by the Ohio Department of Health through the CDC. So the vaccine is getting paid for, but it's through a program. But we can offer the vaccine for free. We do charge an administration fee. So that could be, an out-of-pocket fee, or to your Medicaid if you have Medicaid. So we do have ways to help you with that.
To make it as affordable and convenient for parents
Absolutely.
as possible.
Yep.
And, we do have appointment times Monday through Friday that folks can, call ahead and
Yes, we do by appointment. Yes. And we do ask that the parents bring their immunization record with them so that we can make sure everybody's up to date, especially if they're going back to school and we need to make sure everything is up to date. Make sure they're bringing that card with them so we can add it to that card so they can show the school that it's up to date. I do know the schools too that if there's an appointment on the books,
a lot of the schools,
remind me of that,
as long as they know that your child has an appointment, they'll kind of, they may go past that date that they've given you because...
They'll extend grace.
Yes, they will extend grace and let the child stay in school because they know that child has an appointment.
Right.
Now, one thing the parent can do that I would recommend highly, don't wait till the last minute to call and make that appointment because when school starts, there's all these students that need their vaccines and we've only got so many appointments.
Right.
So there's no reason you can't get those vaccines done in June for the beginning of the school year.
And we try really hard to send information out to the school nurses at the end of the school year, posting stuff on our Facebook page. We've been trying to do some drive-up kind of events. So we have been recognizing that this is a need. But again, I know summers are busy. You're on vacation. Things are coming up. You're really not thinking about school until school starts. But just as a heads up, you're going to probably have to wait. I know some places, us included, we try to double or triple book if we can, but then again, you're still going to have to wait. And I know sometimes you're thinking, I'm just coming in for a vaccine. What's taking so long? Well, there's paperwork that needs to be filled out.
A lot of paperwork.
We got to make sure we have the right, because we have a pot of vaccine for private pay for those with insurance versus those that are VFC. And if by chance you come in and your child's behind and we're trying to figure out what we need to do to get your child up to date, that takes a little bit of time on the nurse's end to be able to sit and think through. Like she was saying, it has to be so many days after this one. Does that make this one? Does that mean we can give it here? Does that mean it's out? So, it takes some time. It takes a hot minute sometimes to make sure we have everything that we need. Because again, our goal is to make sure your child is up to date and safe and ready to go. So correctly. Sometimes it's not as easy as just showing up and saying, I'm here for my vaccine. It is a process, unfortunately, but it is what it is.
Well, I think the important thing is we're going to work with
we'll work with you, absolutely.
And caregivers, if you want to bring your child up to date with vaccinations.
We're more than willing to work with you. We'll give you, we have handed out information to let the schools know that, hey, this is your appointment date. We've given cards out to let them know it's coming, so we will work with you.
Okay.
And one thing I want to know, I'm sorry, I didn't mean to interrupt. Some kindergarten parents think that the vaccines are due on their birth date. So they're used to having that annual appointment that they may get some vaccines and they may say, well, their appointment's in December. That's when their birthday is. But they still have to have their vaccines for the beginning of the school year. So a lot of places, especially the health department, you can take your child to your doctor to get just vaccines and then take them back for their annual appointment or something like that. But a lot of them have to have physicals at the beginning of the year anyway. But kindergartners still need those shots at the beginning of the year. You can't wait until their birthday appointment.
Okay. And just because I know everyone, especially parents and any caregiver of young children, we have very busy schedules. So, if it's a seasonal appointment, so if it's a fall time and, it's a time when we also have the flu vaccine, or if it's a time when their child may or may not be eligible for a COVID-19 vaccine or booster, can they schedule, like say they're, hey, I want to come and get my child their regular recommended vaccines. Can they get their COVID vaccine and their flu vaccine at the same time?
Yes, they can.
When it's recommended. Okay.
Absolutely.
They sure can.
So we can make it really convenient, and that is safe to do.
Yes, it
All
is.
Right.
Yep.
Excellent. Because one-stop shopping is really helpful,
Yeah, especially with some
Sure
of the kids that are in sports, especially those 7th and seniors, they're in a lot of activities and things to
Yes.
do. But, if we can make it convenient and do it all at one time, they may have a couple sore arms for a little bit,
Right.
but, again, they don't have to come back. So
Okay.
I know that's hard to do for kids that are very active.
And they're
Okay.
safe.
For parents. Yeah, and they're safe.
Yes, yes.
That's the goal.
Safety is critical, and the vaccines are safe, and that's helping our children to be more safe and healthy as well.
Absolutely.
So, and
That's our
that's
goal.
Exactly.
really vaccine 101 in a nutshell, right? Vaccinations are safe, they're effective, they've been researched heavily, and they keep our children safe and
And we'd
protect
rather
them.
answer questions than have parents assume they know.
Yeah. So if
so
they
we would
don't
gladly
know,
give you the
talk
answers.
to your healthcare provider
Absolutely.
or ask us when
Exactly.
you're there.
Exactly. Go to a secured, good resource like
Reliable.
CDC, reliable. Yes. Take those questions with you when you go if you're still not sure, because we'd rather educate and help understand. Like with you, or a good example, we've had many conversations
Yes, we
and
have. It's been very helpful.
And being able to talk that through and dispelling some of your fears or concerns, helped you make that decision for your child, whatever that is. But at least
Yes.
it gave you
Definitely
the
help.
information you needed to kind of ease your mind on what you were doing, because you don't want to do anything to your kids. You want to do something for them.
But yes, and
Yeah.
the HPV vaccine wasn't around when I was a kid, so
Yeah.
for me that was new, and I wasn't sure, and I needed more facts, and was
Yeah.
able to ask you and your team of public health nurses, and it's just
Right.
wonderful, to have our Tuscarawas County Health Department as a resource.
Yeah,
and
we
all
would
of
love to
you.
help.
So yeah, we love that. Is there anything else we should mention, or you think perhaps we've done a pretty good job covering?
It seems like we've covered it. I do want to point out that more than 1,000 children a year come down with a vaccine preventable disease. So it's so important to get your child vaccinated.
Okay. Yeah. Yeah. Disease you can prevent, and that's what
exactly.
we can prevent disease with vaccines. That's good. That's a good statistic. Thank you for sharing that. That's a good way to wrap up our show. So thank you very much, Valerie Wallace, public health nurse, and Amy Kaiser, our director of nursing for the Tuscarawas County Health Department. We're so thankful. And thank you all for listening today. This is Public Health, and we've been talking about Vaccination 101 for children. And we hope that you were able to learn and take some great notes today, too. And I'm sure you all got an A. Thanks so much. This is Jennifer with the Tuscarawas County Health Department. Have a healthy and safe day.